you, Dr. Michelle here today to talk to you about thyroid hormone and fertility and how the two intersect and relate. So first we're going to talk about the thyroid and how it works and what it does. So essentially the thyroid is this little butterfly shaped gland at the front of the throat, and it is your metabolic control panel. So it determines at what temperature we run, energy levels, how quickly or slowly the bowel moves, etc., etc. Essentially, the way that it works is that our brain secretes TSH to tell our thyroid gland, please make more hormone. The thyroid in turn should make T3 and T4, which are two of the predominant thyroid hormones, which should execute their function, feed back to the brain, and alter that TSH level accordingly in a perfect system. Signs of hyperthyroidism tend to be unintentional weight loss, anxiety, heart palpitations, etc. The opposite side of that being hypothyroidism tends to be weight gain, heavy periods, low energy, constipation, etc. And so ultimately, in either of those conditions, we can have autoimmune disease at play causing those issues. Hypothyroidism is what we're going to focus on today, given it's more common and the predominant section of what we see to be an issue between thyroid and infertility. But oftentimes there are two antibodies that are at play with what's called Hashimoto's, which is a low thyroid function autoimmune disease. And so those antibodies we can see present both at the level of the thyroid and we can measure in the blood. But there's some interesting research that where we have seen those thyroid antibodies in the fluid that surrounds the ovary. And those elevated antibody levels in the blood have been correlated with recurrent miscarriage rates. And so ultimately we know that despite the fact that the antibodies are attacking the thyroid gland, that we also see impacts at the level of the ovary, and that's just one aspect in which that impacts fertility. And so all of that is very modifiable. In terms of if thyroid hormone is too low, there are medication options. If antibodies are high, there are certainly treatments that we have that can lower those and decrease the risk of miscarriage and also decrease the damage that we see at the level of the thyroid. So all of that is very treatable. All of this is done via simple blood work, and so it's really important that we're testing beyond TSH. TSH is not sufficient, especially in any of the situations that I've mentioned. If you've been trying to conceive for a long period of time, or if we have unfortunately been struggling with miscarriages, this is something that is very much worthwhile investigating and easily done via blood work. And so if that is something that resonates for you, please feel free to reach out to myself, to your naturopathic doctor, or your medical team to have further investigations done because TSH is not enough and there's a lot that can be done. All right, that is my thyroid and infertility or fertility related impacts in a nutshell. See you next time.